Here's another case of soft tissue resection for management of an ingrown toenail. So as I've always said, this channel is really aimed at my professional podiatric colleagues in the UK but also abroad. And although I've really started off doing injection therapy and I'm really a jobbing bunion surgeon by profession, I've spent a lot of time of late doing nail and skin surgery, and this comes as part of a module that I've done for the College of Podiatry in the UK with my good friend and colleague Belinda Longhurst. And we've just put an article out on how we've developed the module, so you'll find that if you look on our ResearchGate profile, and there's a link to this particular video description if you link up above, and just gives you an idea of what we've been trying to do over the last 2 years really.
So Ron, I've obviously put some local anaesthetic in there. Is that taking away the pain? Because when we did that a few minutes ago,
no pain.
That was a bit cheeky, wasn't it? You didn't like this.
I don't feel that. No.
So you've been under the care of one of our good local podiatrists, and they've put, I think, some silver nitrate on that for
That's
you.
right.
That's what that black stuff is. And the silver nitrate's not really done enough because you've got this over-curved nail,
Yeah.
and then here, you can't really see it in the video, Charlotte, but you can see it in 3D, where that's all kind of swollen and cheeky. And I can feel it all the way down to here, all a bit thickened. Or if you've ever been to Kettering, thickened. You ever been to Kettering?
No, it's Ontario.
You ever been Kettering? Have you ever been to Kettering?
No,
Good for you. I wish I could say the same. Don't go.
don't go.
Don't go. So, Ron, we're going to put a little tourniquet on
Okay.
because I've just had the floor cleaned, all right?
Would you be able to cut the other toes nails off first? The other toes?
No, no, no. You want me to cut the other toes off first? No.
You wouldn't get in his way then. would you?
You mean I'm making it look difficult? Thanks, Ron. Yeah, it's not my first barbecue. Yeah, we have to manage sometimes the other toes being
yes,
anyway.
yes, I'm sure.
So that's hopefully going to stop it from bleeding. Charlotte, you're in charge. Are we still in shot?
We
now?
are. We
Okay.
can go down a tiny bit just to get it in the middle of the screen, but we are in shot. Are
Okay.
you happy with
Can I
that?
turn it that way round?
That's better.
Thank you, Rob. So what I'm going to do is take the edge of this nail out. So this is what is going to settle it down just by taking that cheeky bit out. So let's have a look what side of that nail looks like. So that's fine. So the edge of the nail, your podiatrist who've been seeing it is doing a great job. The nail is nice and smooth. What you often find, Ron,
Been doing well.
is a big chunky spur or a shoulder of nail, but she's done great. The silver nitrate was in an attempt to get that skin
Yeah.
here to shrink down. Now, Charlotte, can you see underneath there where you've got this hypergranulation tissue? So this is what's not settled down because of the nail being an irritant. So the edge of that's fairly smooth there now. I might actually take a little blade and just tidy that up. Did I put that on? Can I get that 15 blade, please? We got one to... I just didn't want to quite put it out. So I'm just going to take a little bit more nail out of there. Them's the ones. Just your egg. So I'm just going to make the edge of this run super smooth. So there's just that tiny little bit of nail just to take out. That's that little bit there. So that is now smooth as baby's
You're
bum.
doing what she said would happen.
Now,
there's
we've got two options now really, Ron. So option one is to try and kill that side of the root, but because you're of a certain age and you've got touch of sugar, we want to do as little as possible to you so you heal quickest, okay? So the other option is basically to take away some of the skin. So that's what we're going to do for you. Because this heals quicker. Is that still in shot, Sean?
It is.
And we've got our...
Good job you're not squeamish, isn't it?
Okay. Good stuff, this.
Just a little bit more. You always want to take a bit more off than you think. You always think you've done enough, and actually it's amazing how it grows back. So I actually want to take a little bit more off there. And then the last thing I want to do is just check that the edge of that nail is nice and smooth, because that's going to grow forward there, but now it's not got the skin to grow into, Charlotte. So when we talk about nail surgery, people talk about the nail growing into the skin, which is true, but if the skin's not there, the nail's got nothing to grow into. So everybody talks about it being the nail's fault, but the soft tissue can be a bit of a nuisance as well. And at the bottom there, that's really... Can you hear that? Because it's quite scarry at the bottom. So this has been... I mean, Ron said he's had this for a couple of months. I reckon it's been a good while longer because of the chronic involution of the nail. I'm actually going to be a little bit more aggressive. I found from experience is that, you know, you really want to take this skin away because it actually fills in quite a bit. And this heals, you know, quickly within days. Whereas if we did phenol, you're looking at 4 to 6 weeks. And for our more mature patients with a touch of sugar, it can be even longer. But it's really quite, you hear all that? That's not bone. That's really kind of scar tissue from the chronic induration of the nail. Righty, so Ron, that will probably do it. We'll see you back in a day or two, just to kind of check that that settles down quite nicely.
Okay.
But that's the sort of, in some ways, the least aggressive way of trying to sort it out by taking out that side of nail and skin, but without having to put nasty chemicals on that give you a burn for weeks and weeks and weeks. So we'll put a dressing on now.
And here's an apical close-in shot. So because of Ron's age, he was somewhat of a nonagenarian. Touch of sugar, he was diabetic. Managed really very well by his attending podiatrist and practice nurse in terms of the nail itself had been cut back really well. When you've seen down the side of the sulcus, you can see that the nail had been cut really beautifully. There was no spike. And although Ron thought he'd really only had this for a few months, if you hear right at the end of the video just how hard and rasping that hypergranulation tissue was, that was really fibrotic, really scarred. And it just never settled down because of the involution of the nail. And the video really doesn't do it justice how swollen that lateral sulcus was. So I've done this just aggressive resection of the soft tissue only without needing to phenolize, so I don't need to worry about a delayed phenol burn in a mature guy with diabetes. Although to be fair, you know, he'd probably heal anyway. But silver nitrate ain't not going to do it when you've got fibrotic hypergranulation tissue. So we saw Ron back in 2 days' time. He'd had a little bit of a bleed, but really not that bad. But you can see all that soft tissue's gone now. That will fill in from the bed, but the skin's not there for the nail to grow in anymore, and that really should give him a good long-term result. And then here's the dressing. So we put a big chunky dressing on. We always monitor our patients for a few minutes afterwards, make sure there's no sign of any bleeding or strike through, and there wasn't. But change of dressing in 2 days' time, there had been a little bit of bleeding, but it'd been really comfortable. He'd had very, very little post-op discomfort. These heal within a couple of weeks, and it's a really good option to consider, guys.